Okay, so I don't want to wait too long because we have a lot to cover today. So again, my name is Megan Knowles. I am the Training and Communication Coordinator for the Immunization Program. First of all, I just want to thank everybody for taking the time out of your schedules to join our team for this update. This meeting is being recorded, and a link of the recording as well as the slide deck will be shared with all that have been invited. Please make sure you are muted if you are not speaking. Quite a bit of background noise. Thank you. We do have a lot to get to in this presentation, but we'll leave plenty of time at the end for questions. So please feel free to enter your questions into the chat box now, and we'll make sure to answer them at the end. So this is the planned agenda for today. After many months of the intense work with COVID vaccine rollout, I think I speak for our whole team when I say that talking about something other than COVID is pretty refreshing. Today we will start with our program manager, Chris Finley, who will update us on the 2 new vaccines and some information on flu. Oh, sorry, I just realized I'm not showing. There, can everybody see?
Yes, now we can.
All right, great. Thanks, Mayor. All right, Chris.
Oh, great. Hi, good afternoon, everybody, and thank you from all of our team for everything that you've done, not only with COVID, but maintaining the routine immunizations. Today, I just want to provide a couple updates on some new vaccines and what happened with the flu. So the next slide. I know some of you are hearing about Vaxelis, which is a new hexavalent, meaning that it covers 6 diseases combination vaccine. It's a joint effort between Merck and Sanofi. The FDA approved this vaccine in December of 2018, and the ACIP recommended use in June of 2019, and now it's available on the CDC contract. So it has, if you think about Penticil or Pediarix, it has the one that it was missing because it has DTaP, polio, hepatitis B, and Haemophilus influenza B. You're still going to need the Hib at ages 12 to 15 months, and any Hib conjugate vaccine licensed for a booster dose can be used there. This Hib component that's in this is the same as PVAX Hib. A booster dose of DTaP, of course, is still needed at 15 to 18 months and at 4 to 6 years. And at the 15 to 18 months, Dapticel or Infinrix can be used for this. And Vaxelis has the same DTaP as what's in Penticil. Next slide. So here's a report on the solicited adverse reactions 0 to 5 days. And what I want to say is that there were 6 phase 3 studies that looked at the safety and immunogenicity of Vaxelis, and they found that the safety profile is consistent with that of the licensed combination vaccines, either Pediarix or Penticil. They did note a higher rate of fever was detected when compared with either of those, and that rate they noted was 47% for Vaxelis compared to 33 to 34% for the other pentavalent vaccines. However, they noted that the rates of fever-related events, such as any seizure or seeking medical care or hospitalization, was the same for each group. Okay, next slide. There's a wonderful MMWR that literally goes through Vaxelis, and it's about 3 or 4 pages, but it provides everything you could want to know. And that's the link to that. And then I wanted to make sure you had the prescribing information from Merck, which goes through the specifics of it. And I'm sure that some of the drug reps may have been out handing this to you for a lot of time. The next slide, please. The next thing I wanted to do is talk about MenQuadfi, which is the new Men ACWY vaccine that will replace Menactra. During 2021, my understanding is that Menactra and MenQuadfi will be available, as MenQuadfi maybe in limited doses. There's a lot of different promotion on it, but I wanted to identify that CDC continues to recommend the meningeal conjugate vaccine, the ACWY, for the teens and preteens 11 to 12 with the booster dose at 16. That hasn't changed. And for children and adults at increased risk for those 2 months and older. So the MenQuadfi, again, approved for use 2 years and older. First dose can be used in those 11 and older. Second can be used for a second dose for those 15 or older if the patient was primed with another Men ACWY and it's been more than 4 years since the first vaccine. And there's the side effects that they noted. Again, high level of injection site pain, which we're seeing with a lot, muscle aches, headache, and some malaise. And the next slide, please. So the CDC recently put out a full review of meningococcal vaccines with the recommendations. It's a long one to read, but it is a wonderful reference if you need anything. What I wanted to do is just share this table that on the left-hand side shows you the meningoconjugate vaccines, goes over the recommendation, and then on the right hand shows you the two that are available for Men B and shows the recommendations. And I just wanted to highlight that the Men B series is recommended at 16 to 23 based on shared clinical decision making. And the recommendation would be to consider vaccinating between 16 and 18. That's the preferred age. Next slide, please. So this is where you have all shown. There was so much work that was done this fall, and I just wanted to share something where we saw that flu vaccinations in Vermont increased 16.3% from the 2019-20 season to the 2021 season. And we went up to date, it's 316,200 that have received it. Next slide. We know a lot of work went into this. I just was reviewing the what was proposed to AAP to receive some operational funding, and it was so impressive, and we can learn a lot from all that you did. And what this looks at is the year over year. So based on the year prior, the change in people vaccinated by age. And when you think that those that are 30 to 39 and 40 to 49, they often have children, they're dealing with older parents, they're really right across the whole age spectrum. And look at the increases we saw in every age from 5 and older, but also a 27% increase in the 40 to 49, 24% in the 30 to 39. We know that some of the work that you all did, reaching out to parents, reaching out to your patients, and we saw success. I did see, we did see the slight decrease in those 6 months to 4 years, and that data hasn't been really looked at yet, as far as I know, to try and understand if there's any specific area or need that we need to address this year, but that will be looked at. Next slide, please. So this slide's a little busy, and if you just look at the pie chart, the green is the people that haven't been vaccinated since 2016, so we called those first-time vaccine. The blue is the sporadic, they've skipped at least 3 of the last 6 seasons, and the gray is regular. 49% of those that got vaccinated this year were either first-time or sporadic, so we really did reach people that may not always get vaccinated, and you can see how much that contributed in the not only 18 to 29, but the 30 to 39. So again, it shows the success of the work that you've done. Next slide, please.
So next, Karen Halverson will be speaking about the Vaccine Choice Survey.
Good afternoon, everyone. Annually, we send out a Vaccine Choice Survey. It will go out this year on July 6th, and you'll have the opportunity to make changes in the brands that your practice is using. The survey will be due back by July 30th, and all the changes will be effective with the first regular order that's placed after October 1st. The survey will go out, it'll be emailed to the primary and backup vaccine coordinators and to the physician in charge, and it can be forwarded on to anybody else who's interested in looking at that. If your practice is part of a larger umbrella organization, please assure that your responses are aligned with your leadership. We need to have you all coordinating that on your own end. Included with the survey will be an updated list of all the vaccines that are available. The current version is it's a legal size. It's a light green color this year, dated July of 2020. We'll send the update that will include Vaxelis and MenQuadfi. So you can make changes there if you would like. The expectation will be that that you'll use up your existing supply of the infant combination vaccines, Pentacell or Pediarix, if you're choosing to make that change this year. And we will allow us a transition period so that if you have started infants with either Pediarix or Pentacell but want to make a change in your practice, we'll allow you to keep ordering enough vaccine to finish out those who have started. You don't have to. You can just make a clean switch if you want, whatever your practice feels works better in your office. But ultimately, you'll just have one infant combination vaccine in your inventory routinely going forward. Brand choice is not available for flu vaccines. We receive, I think we had 16 different options this year. We're kind of at the mercy of CDC and the contracts and what products we're getting and what's available at the timing. And we do our best to not have you have multiple products in inventory, but we just can't accommodate choice at this time. Please do refer forward on the list of vaccine availability to people in your IT section who can update your electronic health record. It's not too early to do that when you get it in July. They need lots of notice in putting that into your EHR. I think that's it. Next, I think I'm all set. Thank you.
Thank you so much, Karen. So moving on, we will speak with Inez, who will talk about the Senso recalibration process and upcoming compliance visits.
Yes, thank you, Megan. Hello, everyone. So Senso scientific data loggers are used to monitor temperatures inside the fridges and freezers, and they're coming up for recalibration. Some practices already received their recalibrated probes. So Senso Scientific is the company that will mail out the recalibrated probes 2 weeks prior to the old probe being due for recalibration, and instructions on how to swap the probes are included with the new probe. The old probe will need to be returned, and the return label as well as the envelope are also mailed to you. In case you do not receive it, you can always print out the return label from the Senso Cloud system. Through this process, you will likely receive an alarm notification. This is not a temp excursion. Everything is fine. The vaccine is okay. Once the temperature is in range, just confirm the alarm, and that's absolutely it that you need to do. You might get a call from our program just to confirm that the probes were swapped, as on our end, it's not easily noticeable. Is it the probe swap or is it a temp excursion? As far as the site visits, after July 1, we will start scheduling and conducting VCVP, VAVP compliance and unannounced storage and handling visits. Goal of the visits is to ensure compliance and proper implementation of the VCVP, VAVP program requirements and recommendation. The plan is to visit practices that have not received site visits for longer than 24 months. And as always, visits will be scheduled in advance with the primary vaccine contact and the backup. Thank you.
Thanks, Inez. So moving on, we will speak with Bridget. Bridget will talk about our state's vaccination rates.
Hi, thanks, Megan. Well, the word from the immunization registry is that we're still cranking along. We're a little busier than usual, but we wanted to give you an update on how things were looking for childhood vaccinations. So what we did here in this slide is we took a look at the vaccine coverage in the quarterly reports that we've been sending out to medical practices. Your practice should have received one of these. And what we're doing is comparing the Q1 from 2020 with the Q1 from 2021. In this particular age group, the COVID vaccination hasn't changed very much, hasn't changed the situation very much. We still see that in the series where there are 3 or 4 doses required by the age of 2, it's difficult for people to reach that. Those are the most challenged series, but generally speaking, we're not seeing a difference. Next slide, please. What we're looking at in this slide is actually 2021 data. And I wanted to show you the difference between measuring coverage when by the age of 2 versus measuring coverage between the ages of 24 and 36 months. And what you can see is that there's a significant amount of vaccine that's given in that time period. Again, especially in those particular series. Next slide, please. This is the comparison looking at the older age group. So between the ages of 24 and 36 months, here's where we are seeing a bit of a difference between 2020 and 2021.
Oh, hers is working.
Hello? It's not a statistically significant difference, but we are seeing more of a decrease in this age group. Next slide, please. The good news is among your 13, 14, and 15-year-olds, where we're looking at HPV series initiation, HPV series completion, meningococcal coverage, and Tdap, we're not really seeing any effect of COVID. So yay for providers out there who are keeping immunization going, and we hope to continue to increase this towards some of the goals that we have for coverage. Next slide, please. Now I have a request for medical providers. I know that you have a lot of people coming into your practices, teens now, who have had COVID vaccinations elsewhere, either at a mass clinic, at a hospital, at a pharmacy. If you want to enter this information into your EHR, it's really critical that you enter it accurately. The reason is we already have the correct information in the immunization registry. Please do not record an approximated date based on what a parent says or an estimate or the date of the patient's visit at your clinic. All of these result in overcounting of Vermont shots, and we have to clean those up at our end every day. If you do have someone show up with a vaccination card, please do feel free to enter that into your system. And please do, of course, record all doses that your location administers quickly and accurately into your EHR. I know most people are sending HL7 messages at this point. We have a few that are directly entering, and we appreciate everything that everybody is doing. Next slide, please. We've also developed 3 new reports specifically to help you assess COVID vaccination coverage in your patient population. So there's now a report in the registry of patients who've not received any COVID vaccine doses. This is actually under the patient list by practice report. There's a link in this presentation. We're also going to be putting up a tutorial on our website that'll walk you through this and each of the other reports. The second report is for patients who are late for their second dose. You can print a list of those people directly from the immunization registry. And finally, if you'd like to get a list of your patients who have received a COVID vaccination dose, including the lot number and where they received it and the type that they received, you can print that out for any age group through the Patients Immunized by Series report. So I encourage you to take a look at that. There's how-tos for all of this, again, on the immunization registry homepage. Next slide, please.
Thank you, Bridget. So moving on, we're going to talk about the vaccine rollout to primary care, and Meredith will be helping us with that.
Hi, everybody. Thank you for joining us today. I wanted to start by saying thank you to all of our partners who have helped to vaccinate in community clinics and mass vax clinic sites over the last 6+ months. We could not have done what we've done without everybody's help. And I just wanted to review the onboarding process for primary care offices to offer COVID vaccine. So we're approaching the end of our mass vax clinics, and we want to try and normalize COVID vaccine. And the immunization program has started to onboard primary care offices to offer COVID vaccine. For all state-supplied COVID vaccines, CDC requires that a provider office be enrolled with our program. So for your normal enrollment for non-COVID vaccines, you have to enroll for either the child and or the adult program. And CDC requires an additional enrollment to house and administer COVID-19 vaccine. Once the provider office completes the COVID vaccine enrollment process, they can receive a shipment, store the vaccine, and administer the vaccine. And there really are 3 buckets that primary care offices fall into, and each has a separate COVID-19 enrollment process. So we have federally qualified health centers. There are 11 FQHC umbrellas across Vermont, and they have a total of 44 adult and pediatric primary care offices. So FQHCs can actually enroll into a federal program and receive federal allocation of COVID-19 vaccine. That program is through HRSA. And the immunization program has been working with by state and the FQHC umbrella organizations for about 2 months now to onboard those offices. So we're still working with some of them, but most of them are on board and offering vaccine through their normal daily operations at this point. There's hospital-owned practices. So 2 weeks ago, the immunization program spoke with all hospitals to discuss the addition of COVID vaccine in primary care offices. And as a follow-up to that conversation, a request for information was sent to hospitals last week asking for their plan to continue to offer vaccine. And we have responses from all the hospitals except one at this point. And the hospitals are telling the immunization program when their PCP sites will, or if and will, offer COVID vaccine. So no hospital PCP office, primary care offices are currently offering COVID vaccine. And just a note for hospital primary care sites, some of the hospitals with ultra cold storage capacity have offered to be a local hub for Pfizer vaccine in their region of the state, which is going to be super helpful. And then independent primary care offices. So we have, we offered some selected independent primary care offices to onboard a little bit earlier than others. And the initial invitation was based on patient size, location, and the ability of the offices to manage a minimum vaccine order size. That invitation was sent out to 20 primary care sites. 14 are now onboarded and offering vaccine within their offices. And those sites are being served by the vaccine depot and direct shipments from the manufacturers. So last Friday, all COVID enrolled primary care independent practices received an invitation to provide COVID vaccine in their office, regardless of their patient size. And our vaccine depot, which is housed in Chittenden County, will help serve those smaller practices that cannot order the minimum shipment from the manufacturers. There are still about 25 independent practices who've not completed their COVID-19 enrollment process and are not eligible to receive COVID-19 vaccine at this time. So if you are an independent practice and your office would like to offer COVID-19 vaccine and you have not heard from us, please reach out. If you're a hospital-owned practice and you have questions about when your office will start to offer COVID-19 vaccine, I would direct you towards your hospital administration for the plan. And if you're an FQHC and you have questions about offering COVID vaccine, I would check with your umbrella organization for your plan. So that's really what I have. I just wanted to Also say that if you are getting vaccine through the state, there is a expectation that you'll reconcile weekly in VIMS. It's much like the flu reconciliation last year where you could do a flu only reconciliation. We want you to offer COVID vaccine to your patients in your normal clinic flow. Second dose planning for the 2-dose vaccines is up to your office to schedule and manage. And the big message that we're getting from CDC right now is please don't miss opportunities for fear of wasting. We're in a very different spot than we were when we started our vaccination effort. And we're to the point where we want to catch people where they're at. So if they're in your office and they want a vaccine and you have COVID vaccine, it is okay to open that vial and give that dose. And I think that was it for me, Megan.
Okay, thank you, Meredith. So just to round out the presentation, we are going to go back to Chris Finley, who's going to talk a little bit about the immunization program and health equity.
Hi, everybody. One of the things I wanted to note is the COVID-19 response has really led to an awareness in all of us of the recognition of the importance of health equity. And I know you've heard much of that in the press conferences or in the summary that's out there. One of the things that we've seen in the immunization program and in the health department is an absolute need to better address health equity across all populations. And the CDC has recognized this and provided some separate funding for us to work to address health equity, working with community-based organizations and local health offices. And I just wanted to mention this because we'll be coordinating the health department with the health department and their broader piece for the plan and the development of addressing disparities. And we'll be working to support the community in these efforts. But my experience has shown me that the primary care is a key partner in with understanding issues related to health equity in your community, what the needs are, and wanted to say that as we work to do this, we'll be reaching out to you. Now, when we talk about, I just want to mention that when we talk about those populations that were disproportionately impacted, we're talking about people living in rural communities, people with disabilities, people that are homebound or isolated, uninsured or underinsured, immigrants or refugees, those with transportation limitations, and those that are racial and ethnic minority groups. I think sometimes we hear just a narrow part of that, and I wanted to make sure you understood that. We will be expanding some of the staffing in the health department within the immunization program so that we can better address that. We also will be bringing on someone to support our ordering team of Karen and Alon. I know you've all worked with Alon and who's worked tirelessly on the routine immunizations, and we're glad to be getting some support. And we'll be making some other changes with that. And before I open it up to questions, just one other thing I'll note is I'll be retiring in another week, and they're recruiting for a new program manager. I can put the link up if you want to look at that. But there will be probably some changes coming in the program as we continue to move forward and address COVID and build in the needs for the routine immunizations. So let's open it to questions.
Thank you so much, Chris. And I'll speak for everybody in our program that it's going to be hard shoes to fill when you leave us. I will start with the chat. Feel free to also raise your hand if you would like to ask a question. Some of these questions have been answered already in the chat, so feel free to go in and read that information, and I will make sure that the links that have been shared by Chris and others make it with the slide deck. So the first question was about the side effect profile of the MenQuadfi, and then Chris shared a pretty extensive document for that, so I'll make sure that that gets included. Will individuals 65 and older be excluded from the flu immunization program like previous years prior to the exception that was in place for 2020? So Chris, I know you answered that in the chat, but would you like to just speak to that a little?
I would absolutely. So last year we received we received some vaccine at no cost from CDC, and we received funding for flu. Unfortunately, this year, when we had to do the order in late January, early February, we had no idea what the CDC support was going to look like for this. But we also understood the challenges that the practices are under and how constant change makes it difficult. So we made the decision with limited information that we would continue to provide vaccines for those 65 and older, even though at this point, Medicare isn't paying into the Vermont Vaccine Purchasing Program. It's something that's being worked on. But for this year, we are providing vaccines for everyone, all ages. The caveat there is that the 2 vaccines that are intentional for those 65 and older, the specific formulations, Fluad and high dose, are not available for us to order.
Oh, Chris, you got muted. I'm not sure how that happened. Sorry.
Are you kidding? Okay.
It was just a second, Chris. It was just the end. Oh, you got muted again. I don't know what's happening.
Okay, I'm unmuted now. I'll keep an eye.
Yes.
Sorry. I apologize. So we had to make a decision in January or February about whether we would cover 65 and older. We didn't have any information from CDC. We were concerned about constantly making changes and how that impacts your ability to try and follow what's going on. So we made a decision that we would continue to provide vaccines for all ages, including 65 and older. One of the challenges, though, is that on the CDC contract, we can't purchase Fluad or high dose, which are specifically formulated for those 65 and older. So if you want those in your practice to receive that, you would need to order that. And then just one other note is that Vermont Vaccine Purchasing Program, where insurers pay in to buy vaccines so that we can have a universal program, Medicare doesn't pay into that. So as much, and we're working with them with Representative Welch and others to try and get those changes made. So as much as we'd like to continue this in years coming, if they don't continue to do that, it may be that we won't be able to do it past this year. Sorry.
Okay, thank you. Thank you very much, Chris. And there's a lot of questions in the chat, so hopefully we can try to get to them. It's a little hard for me to manage it. I will just move on to Kathleen did ask about starting a pediatric series with Pediarix and then switching to Vaxelis without issuers that recommended to complete with the same product. Karen, you did answer and provide an article, but did you want to just mention anything else about that right now?
I provided information from both the FDA and the ACIP with a link to the entire document. It's not a requirement that you use the same brand throughout. So it's really a clinical decision on your own to make. You can go with an entire suite of all one manufacturer, or change those out as you choose. The full link is there for you to make more decisions.
Can I just jump in and say that if you were to look at the MMWR on Vaxelis, it does note that it has the same amount of DTaP and the polio is a little less. So it compares, it tells you how those ingredients compare to what's in the other ones. And so it's not an even swap for anything. So that might impact your decision to finish people up with the pentavalent that you start them with.
Okay, great. So there was a question about those providers that are still using paper charts, and Karen said that she will, thanks for the reminder, and that they'll work on updating that to accommodate the paper chart people. There are a couple of questions regarding the registry. So Paul Parker asked, are pharmacies being instructed, given access to record the COVID vaccines that they are given in the registry? That would be highly desirable and more efficient. Bridget did answer this and said that the pharmacies are providing the vaccines. There is also a question about identifying the patients who have not had one dose or no doses of the COVID vaccine. And I think this is with regards to the IMR reporting options. So Bridget, would you want to speak a little to that?
Sure. So we actually made a modification to the very first of the practice level reports called the patient list by date of birth report. When you click on that report, there's now a checkbox where you can just list the people in your practice who have not gotten a dose of COVID vaccine. So you can print that list, like a list of people with their phone numbers. You can also print a list of mailing labels if you wanted to reach out to those people. A limitation of this would be if you're not a pediatric practice and you have patients in your practice that the registry doesn't know are your patients, they wouldn't necessarily be included on the list, but it certainly would give you a big advantage in identifying people in your practice that haven't had any vaccine.
All right, thank you, Bridget.
Sure.
So I think that this is a question for Meredith. Does the saline come with the COVID vaccine order?
So yes, Pfizer requires that you use a preservative-free normal saline to dilute their vaccine. So if you order Pfizer, the diluent comes and ancillary kit supplies come. Moderna and Johnson & Johnson do not have a diluent, so the vaccine comes with just the ancillary supply kits. And ancillary supply kits really are needles and syringes, alcohol prep pads, the vaccine, COVID vaccine card, and then some limited PPE come as part of a vaccine shipment when you order COVID vaccine.
So Meredith, before we move away from you, there's another one about the COVID vaccine. I'll also just say that if you do become a COVID enrolled provider and decide that you'd like to manage the COVID vaccine in your practice, we will provide training to you and your staff and make a bunch of resources available, just so you know that we're here to support you if you do decide to go in that direction. So the question was, what is the time frame in which a vial of Pfizer needs to be used and once opened? And does it need to go back into the cold storage?
So all 3 COVID vaccines need to be used within a limited amount of time once you puncture the vial. All 3 are preservative free. So Pfizer has to be used within 6 hours of puncture, and that's the puncture to dilute it. And yes, it can go back in the refrigerator. All of them have specific temperature storage requirements. So I'm not going to go into all 3 of them. As Megan said, if you become a COVID provider, we provide all of that information to you. Moderna has to be used within 12 hours of puncturing the vial, and J&J has to be used within 6 hours as well.
Great, thanks. There is a question in the chat regarding an individual practice's enrollment. I will say that if you have any questions about enrollment, you can email our program at the email address on the screen right now. Inez, would you, because enrollment was so long ago for the COVID program, for the 25 practices that may not have completed it, would you be able to just speak a little bit to what that process looks like?
So initially enrollment was opened back in November, and multiple reminders have been sent out to practices regarding enrollment. So whoever is interested at this point to enroll, please reach out to us to the immunization program inbox, and we'll get you the enrollment link, user, and a unique username and a password, so you can complete the enrollment form and get the process started. And if you need any assistance completing the form, just let us know, and we can definitely assist with that. But as far as the process itself, the first step is enrollment form completion, getting it signed by your medical director and your CEO, and then moving on through the rest of the process of vaccine storage verification, and then coordination as far as vaccine need and request before you even get the vaccine. So just because you completed the form doesn't mean you're going to get the vaccine the next day. It doesn't really work that way. We are not that fast. There's more coordination that needs to happen. So, and you are definitely included every step of the way before you get the vaccine. Thanks.
Thank you, Inez. I'm sure that will be helpful for some. So Kelsey, Patsy Kelso did put the job posting for Chris's position into the chat, and I'll include that when I send the slides out. And if you have any questions, you can reach out to her. Her contact information is also in the chat. A question about what looks like out of state residents. So there are college students returning from out-of-state schools and received first vaccine out of state, so it's not captured in the registry. Bridget, do you have any information on how those records would be captured?
If the student shows up with a vaccine card, then we highly recommend. In fact, we plead you to please put that into the registry as a historical dose. We also have had people contact the registry with this concern, and they have a vaccine card from out of state. We have accepted some of those to be, if someone sends us a photo of the vaccine card, we've actually put it into the registry. So we're doing everything that we can in order to get appropriate information into the system. The thing that messes us up is if you estimate a date. So just please don't do that.
Okay, thank you, Bridget. So I know Meredith answered this, but I know that this is a really common question. So are there any plans from the industry for providing single dose vaccine? Because of how it would be very helpful, but Meredith, do you want to speak to that a little?
Absolutely, and this is a question that we've been asked quite a bit, and that
Oh, Meredith, you got muted.
sorry about that. While the vaccines are being used under an EUA, they will not be reducing their size to a single vial or a pre-filled syringe. Once the vaccines are fully licensed, the manufacturer can then decide how to package the vaccine. I have not heard any indication that they are looking at that anytime soon. So everybody's asking, you're not alone.
And just another common question that we're getting, again, you already answered it in the chat, but you're hitting on the high points, the monitoring period. Can you speak a little bit to that and how practices are being creative in getting around that?
Absolutely. So any COVID vaccine, because it's being used under an EUA and it's new, they want patients to be monitored for a minimum of 15 minutes after they get the vaccine. Anybody with a history of anaphylaxis, and it doesn't matter if it's a medication, a food, an environmental, if you've had a history of anaphylaxis, they want you to stay and be monitored for 30 minutes after the vaccine. So this can look very different depending on the layout of your clinic, the size of your waiting room, what works best for patient flow. We've had some people give the vaccine right at the beginning of the appointment so that your time in the room is the time that you're waiting after your vaccine. We've had some clinics who have large waiting areas where patients can go out and sit for their observation period after their vaccine. So it really depends on what works within your flow, but yes, you have to monitor for a minimum of 15 minutes for anybody without allergic reaction and for 30 minutes for anybody who does have that history of anaphylaxis.
Thank you, Meredith. There's a question about where would we find the report that shows our patients who haven't had the COVID vaccine. So that report was linked in the slideshow, and so the slide deck with that link will be sent to you following this meeting. And then Dr. Parker did have some words for Chris, saying good luck to the individual trying to fill Chris's shoes. Chris has done a fantastic job. Best wishes and have fun in your retirement. And I think that most of the providers on this call have a similar sentiment as Dr. Parker. So I think one more for does administering a COVID vaccine to a non-practice patient assign the patient to the practice? I know that this is a really common question. So Bridget?
It does not. Neither does flu. We have changed we've changed the business rules in the registry so that immunizing a patient with either COVID or flu does not make them your patient. It also doesn't make, if your patient gets a shot at a pharmacy or at a mass clinic, it doesn't take them away from your practice either. So I hope that's helpful.
Great, and I think I've gotten to the end of the questions in the chat, unless someone else from my team notices that I've missed anything that should be spoken about. Feel free to enter some more questions in, or you can raise your hand to speak. All right. Well, if there are no further questions, we want to be conscious of your time and maybe you can all actually get a lunch. So thank you, all of you, for all the hard work you're doing, and thank you for joining us for this meeting. We're hoping to have them a little bit more consistently moving forward to provide you with programmatic updates. If you have any resource needs or questions for us, please just email the email present on the screen. And I hope you all have a good rest of your week.
Thank you, everybody.